ChatGerry, stroke risk progression through diabetes, hypertension, and cerebral vessel calcification. Number 1355, September 13, 2025. Gerald C. EclaireMD Foundation. Category: Stroke. For more than 3 decades, I lived with type 2 diabetes. In the first 2 decades, I did not manage it well. My hemoglobin A1C once reached 11%. This prolonged hyperglycemia silently scarred my blood vessels. Between 1994 and 2003, I suffered 5 cardiovascular events, clear warnings of vascular stress. By 2010, I finally controlled my diabetes through lifestyle changes, maintaining hemoglobin A1C in the safe range for the past 15 years without medication. Yet earlier damage had already left permanent scars. At the same time, aging stiffened my arteries. My pulse pressure rose above 40 mm of mercury and reached to 50 mm of mercury, and kidney disease disrupted calcium balance. These changes created the perfect environment for vascular calcification. Hypertension was another hidden driver. I was never formally diagnosed with chronic hypertension, but I experienced what is now called masked hypertension. Episodic surges at night, in the morning, or during stress and exercise. These surges, often missed in clinic visits, inflicted repeated micro-injuries. Over decades, they compounded the effects of diabetes and aging, accelerating cerebral vessel calcification. On June 21, 2025, I suffered my first stroke. CT scans revealed bright white calcifications in small vessels of my brain. MRI confirmed chronic small vessel disease, a common pathway toward both ischemic and hemorrhagic stroke. Looking back, diabetes was the dominant factor, aging, the constant background driver, and blood pressure surges, the accelerants that pushed fragile vessels over the edge. Quantitative findings. Using my personal longitudinal data from 2012 to 2025, I applied the viscoplastic medicine theory, VMT, energy model to quantify my cumulative stroke risk. Stroke index dropped from 152 in 2012 to approximately 94 in 2025. 38% reduction, but plateaued after 2020 due to irreversible calcification. VMT energy contributions: diabetes 41.4%, hypertension 32.0%, calcification 26.6%. Cumulative energy progression: sharp rise before 2014, plateau from 2015 to 2017, jump to 100% by 2019, then stable through 2025. Most vascular damage was already accumulated before 2019. Later interventions slowed decline but could not reverse existing calcifications. Conclusion: this 14-year study shows that stroke risk is not caused by a single incident, but by the cumulative interaction of diabetes, hypertension, and calcification. Even with strong diabetes control in later years, prior vascular scars locked in a persistent stroke risk. From a systems perspective, my case illustrates the nonlinear, dynamic, and irreversible nature of chronic disease. Prevention must begin early, long before irreversible damage sets in. Compared with many stroke studies that rely only on statistical correlations, this work integrates both pathophysiology and quantitative modeling. It demonstrates causal pathways and cumulative, nonlinear effects with scientific depth and personal authenticity. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.